my name is Kimberly Sanchez, and I am a second-year PhD student at UC Merced in the Public Health Department. And the title of my project is Food Insecurity in the San Joaquin Valley. So a little bit about myself. I graduated from Cal State Long Beach with a master's in public health with an emphasis in community health education. And during my MPH, I was part of a Latino health research center where I was part of two different projects. The first project, I was part of a childhood obesity prevention program where I was a health educator for parents and their children. The second project that I was involved in was I was an evaluator for SNAP enrollments. And with these experiences, I noticed that many families were food insecure. Many of them qualified for SNAP benefits, but they were just too afraid that their immigration status would be exposed. So now moving on to my project. My project is based in the San Joaquin Valley. The San Joaquin Valley is a predominantly low-income rural region. There is high agricultural productivity, and as you can see, it's composed of 8 different counties, as we can see on the right. And we are known as a breadbasket of the nation. But although we are known as the breadbasket of the nation, there are still plenty of food insecure families in the San Joaquin Valley. So food insecurity rates in the San Joaquin Valley are much higher than the overall rate in California. And much of this food insecurity is due to families having low availability and access to nutritious foods. And as we know, low nutritious foods may lead to obesity in the future. So similar to food insecurity rates, the rate of obesity in the San Joaquin Valley are higher than the overall rate of obesity in California. This is important as it leads to higher rates of chronic diseases such as high blood pressure and diabetes. And we have seen that food insecurity and obesity rates will increase in the next couple of years due to COVID-19 challenges. So as we have already mentioned, and a lot of my teammates have also mentioned, COVID-19 definitely exacerbated a lot of health disparities that are going on with our minority communities, and will continue to impact them for many, many years. Some of the challenges that low-income families are facing when accessing healthy foods during COVID-19 would be, for example, the closure of schools where children relied on school lunches, transportation to grocery stores. They might have grocery stores that are too far away from them, loss of economic support, such as the loss of a family member, medical bills, or maybe even the loss of a job. And we also heard about food hoarding, which basically a lot of these low-income families could not do food hoarding. So then that would leave them with empty shelves when they would go grocery shopping. So in order to make ends meet, food insecure families may resort to government assistance programs such as WIC or SNAP, or to food distribution centers. However, many of the food distribution centers have a purpose of alleviating communities from hunger, but they don't really pay much attention to whether the foods they are distributing are healthy for our communities. So if we can have food distribution centers distribute high nutritional foods, we can help decrease obesity rates in Latino families, and therefore we can help prevent many chronic diseases. And I believe that food is a health equity issue that needs to be addressed. So for my study, I looked at 3 different aims, which were also modified for the pandemic. I looked at whether food distribution centers were offering healthy options to their communities. I wanted to explore what type of challenges they were facing with COVID-19. And I also wanted to come up with a couple of policy and program recommendations that could help improve the access and availability of healthy foods. So for my study, I used the Nutrition Environment Food Pantry Assessment tool. I'll be referring to it as the NEFPAT tool. And this NEFPAT tool just assesses the nutritional value of foods. And I also modified and added a section related to the challenges of COVID-19. So what I did for recruitment, I compiled a list of food distribution centers in the San Joaquin Valley, and I just called them, and we completed the surveys either through phone or I would send them a link to their email. I did face a couple of recruitment challenges in this aspect because when I was backed up waiting for the university's research ethic review board to review my materials. So basically the review board just makes sure that we aren't harming any participants with our study. Also, I found challenging to call different distribution centers because many of them were not able to answer the questions that were on the survey. So they would send me to other representatives from the warehouse. So this slowed down a bit the recruitment process for me. However, my study is still ongoing. So in the preliminary results, I found that there were 3 major organizations that are distributing food to the community, and those are churches, food pantries, and food banks. So as you can see, the food pantries and food banks have availability of all types of food groups, whereas the church did not offer as many food groups. Therefore, the church didn't really deliver as much healthy foods than the food pantry and food bank. This could be because maybe the church relies heavily on monetary and food donations, whereas the food banks and food pantries are partnered with like USDA or other government assistance programs, or they've applied to different types of grants. For my second aim, I noticed that all organizations had similar challenges. All types of organizations had an increase in families being served a month, and they also saw a significant decrease of volunteers. However, each type of organization did highlight their unique type of challenge. So for example, the church mentioned that they did not have a refrigerator to take in fresh fruits and vegetables. For the food pantry, they talked about how it was difficult for them to meet the demand of food and financial assistance to the community. And also they believed that meeting the workload of increased customers and fewer staff was a challenge. For food banks, we see that they also believe that it was hard for them to keep consistent volunteers to keep the program running. So they would see a lot of volunteers dropping out and then coming back in. So that was really hard for them to keep a consistent program running. So with these preliminary results, I came up with a few recommendations that may help improve food insecurity and obesity among low-income communities. Some policy recommendations I have for CARE and for the general public would be assessing the nutritional quality of foods of different distribution sites, just to assure that they are distributing healthy foods. Also assessing the quality of programs that are being offered, so whether they are offering nutrition education or any other type of resource to the community. As far as for program recommendations, just creating healthier options for the community is a really big one. For example, we have seen this new tendency with community fridges. Community fridges are basically fridges where the community can drop off excess fruits and veggies from their backyard, or they can also feel free to grab any produce that they may need. Another example of creating healthier options in the community would be funding for fridges. So in the results, we also see that like smaller organizations like churches don't have enough cold storage for perishable foods. So helping these organizations find funding for fridges and other materials they might need is also very essential. Lastly, I came up with a digital outreach. So this is, for example, like sending out a text message to members who sign up for the texts and letting them know where they can access free fruits and veggies. So it's just a reminder of where they can go, what times, and this, I believe this would be a good way to reach the community. So with the help of CARE, I was able to work on food insecurity work during the summer. The next steps for my research will be to continue testing the tool that I have modified. I would like to keep assessing the types of services that food organizations provide, such as the nutrition education, health education, and whether they do provide nutrition education, health education, then I'd like to assess whether they are culturally sensitive to the population they are trying to reach. So if you're interested in helping, there are plenty of simple ways that you can go about it. Some examples can be something as simple as participating in a nutrition education workshop. I believe that knowledge is power, so why not pass it along to those that we work with? In addition, we can also support local community fridges. You can go to the website that I have put on my slide, or we'll put it in the chat box in a bit. Or if you don't have a local community fridge, you can always start one. And thank you.